Well, thank you very much, and good afternoon, everyone, and thank you for joining us here today. Today, we are reporting 8 additional cases as well as 11 new recoveries. New case numbers have been up in recent days and here in Saskatchewan as well as other provinces across Canada. And while the number of cases in Saskatchewan is still relatively low and quite manageable, the recent increase should be a reminder to each and every one of us that COVID-19 is a very contagious disease for all of us. And we all have to keep practicing all of the good habits that have helped to control the spread thus far. Now, I know it's summertime and we've been at this for 4 months now, which seems like an eternity. So it may be tempting for some of us to relax these practices from time to time. Don't. Please don't relax. We know that COVID is not a seasonal virus. It doesn't dissipate in the summer. It doesn't respond to a change in season. It does, however, respond to a change in behavior. If we maintain our good practices, the number of cases will go down. If we let up, the virus will spread and the number of cases will increase. So keep your physical distancing, as we have. Continue to wash your hands, as you have. Continue to limit the number of close contacts outside of your household that you would come in contact with. Wear a mask when physical distancing may not be possible. That is how we will continue to protect ourselves and continue to protect our families. Today in Saskatchewan, almost everything is open again. Most of us are back at work. We can enjoy most of the summer activities that we all love. Crop is looking great in many parts of the province. So there are a lot of good things that are occurring in our province right now. We just need to keep being careful. Keep controlling the spread of this virus so that we can keep all of these good things that are happening continue to occur. Today we are announcing the restart of a couple of more activities, garage sales and yard sales, for instance. Door-to-door canvassing and sales can begin again, and that would be effective immediately. And like just about everything else, these activities are going to look quite a bit different than they did a few months ago. All of the guidelines for doing these activities safely can be found in the Reopen Saskatchewan plan on the Government of Saskatchewan website. Finally, I just wanted to once again thank everyone in Saskatchewan for everything that you are doing. I know everyone in this province has had to change almost every aspect of your life, whether it's at work, whether it's at the sport that you may play, or whether it's just visiting your parents or your grandparents. It's all very different now. I do not for a second take that for granted. I do not for a second take for granted everything that we are asking each and every resident of this province to do. And I know that it's asking a lot. But I also know that it's working, and it's working quite well. So please keep it up, Saskatchewan. Thank you. Dr. Shahab?
Thank you, So I'll just maybe update numbers for the last several days. So we have in the last 4 days have had 38 new cases reported, 2 in the far north, 2 in the north, 15 in the central part of Saskatchewan, mostly the center-west part, 8 in Saskatoon, 11 in the south. And we have had cases in all categories, travelers from other provinces, as well as international travelers, community contacts, and a few for which ongoing investigations are happening, and some where there's no known exposures. So these we call sporadic community-acquired cases. Of the 970 cases currently in the province, 142 are active and 813 have recovered. And currently we have 12 people in hospital with 3 in intensive care. We obviously monitor our effective reproductive number. So similar to when we had increase in transmission in the Northwest, our effective reproductive number for Saskatchewan overall is 2.29, and this is primarily because the recent increase in cases in the southwest and central west part of the province. For the north now, of course, it's now under 1. So again, we have to appreciate that with intense efforts, with community leadership, with testing, increase in testing, and increased case count investigation, you always see an increase in cases that may be concerning, but that is absolutely essential to, for public health to work with communities to break the chains of transmission. And so North, I think, deserves our recognition and gratitude for really working hard, the Saskatchewan Health Authority with Northern leadership and the residents and communities in the North for really addressing a very challenging outbreak. And similarly for the Southwest and the West Central part of the province, they've had increased transmission in specific communal living settings, but also sporadic cases in the general community, both Southwest and Central West. But we're already seeing an increase in cases that are recovering. So from that perspective, I think it's important that we all of us need to be aware of when to seek testing, to stay at home when we're unwell, and similarly really support public health when they are doing case content investigation. There've been several businesses, for example, that were announced in public service announcements. Again, we have to understand that sometimes businesses proactively make that announcement even when there's not a need to, but when public health needs to announce an exposure setting, what that really means is that there's a low risk that you may have been exposed at a certain setting, and so far we have not seen transmission from those recent announcements. But it's just raising the awareness that if you have been to any of these businesses, you may need to be aware for a couple of weeks and self-monitor and seek testing if you're unwell. But that really applies to everyone in any case, and that really should not impact any of those businesses. And similarly, some of the colonies or communal living settings where there have been cases, a lot of the increase in cases has actually been due to active collaboration with public health, active case finding, and those settings need to do that to identify asymptomatic or mildly symptomatic cases, so that individuals who are positive or who are contacts isolate, and that's the only way you can get ahead of the outbreak in a timely way and get back to almost normal operations. But obviously, even in communal living settings, if there's as long as there's a pandemic, they have had to now look at changing some of their own routine operations where they need to minimize transmission within those settings, whether it's around meals or around other activities, worship. That again, this applies to all places of worship, but they had to change how people go into places of worship. 2-meter separation between households, and just some of those cautions around multi-touch services. So I think this is the new normal for us. We will continue to see clusters or outbreaks. We hope that they will be small, sporadic, we'll be able to overcome them quickly. But I think over the next little while, we need to just be aware that we need to just practice what we have been doing so far really well: physical distancing, not going out to an event, even if there's a lot of peer pressure, which can happen, or you can yourself feel obligated to go if there's a funeral of someone who is near and dear to you. But if you're unwell, you should not go. If you do attend, it should be a small event with appropriate physical distancing. And I think those things are going to be really important over the next little while.
Thank you, Premier. Thank you, Dr. Shahab. We'll take our first question in the room. Arthur?
This is for the Premier. There's a lot of chatter on social media right now about the $3 million for the Rough Riders bid, or for the CFL Hudson bid, and whether it's the best use of money in the midst of a pandemic. There's people that are bringing up Aid Saskatoon's bid for the $1.3 million for their safe consumption site project. The teachers are bringing up the need for a specific sum to keep classrooms safe. What do you say to people that question whether the fact that you were able to so quickly find this money when you weren't able to find money for some of those other priorities?
So these, this commitment was made through the Rough Riders with respect to the bid, and they put forward a good bid on on hosting whatever a modified season would look like this particular year. I would credit. I think we should just back up a little bit and provide some credit to a number of organizations that have come forward, and to the CFL and the Commissioner Randy Ambrosi himself for the effort that they are making to really salvage, the strength of the league and salvage some degree of a season here this year. The Calgary Stampeders had put forward a bid, the Winnipeg Blue Bombers, and of course our Saskatchewan Roughriders. And I'd also extend credit not only to those three organizations, but in particular to Craig Reynolds and the Saskatchewan Roughriders organization, and all of those that were involved in this particular bid. The reason the government of Saskatchewan is supportive of this bid, as many other organizations like the Regina Hotels Association and others in and around Regina, was the economic opportunity that this bid does represent. We are trying to recover our economy here in Saskatchewan, and this is one opportunity that we have with an application that would most certainly fill a number of hotels here in and around Regina, would create some economic activity, as all of those people would be eating, and would, although they would be in a bubble, it would be a boost to the local economy and to some degree the provincial economy as well. This is this is a league that is over 100 years old now. We have a franchise in this city, in this province, that is 110 years old, and they are very much working together as teams, as communities, and as Canadians to salvage the Canadian Football League. And ultimately, it will come down to, yes, a decision on where this hub city will be. And there's 3 good offers there. There's some challenges with Saskatchewan's offer as well, and we should identify that. International flights are a challenge into Regina, and that's something we continually need to work on for the broader benefit of Saskatchewan people, not just for this particular bid. But there is none of this moves forward without the support of the federal government. And the CFL, the Canadian Football League, has been working closely with the federal government. I believe the Players Association as well has been working closely through the CFL with the federal government. And the federal government ultimately has a decision to make before I think there's any hub city activity that does occur. So we look forward to a positive outcome on our bid, in part because we love the Rough Riders, but also in part because there is a financial there is an economic boost to hosting an event such as this. But we also look forward to a positive and strong CFL league as we move forward, league where our Rough Riders can play not only this year but in years to come.
Follow-up question, Arthur?
Yeah, but what do you say to groups that have come forward with, requests to the government that in some cases were life and death issues, like the safe consumption site, and didn't find what they were looking for, and yet you were so quickly able to come through with this money for the football team?
Yeah, no, there's a number of organizations that have come forward year in, year out, not just this year in, year out for, I imagine, every year that government has been here. And there's decisions that we make through our budgetary allocations each and every year on how can we best serve the people of this province. For example, you look at some of our mental health investment over the course of the last few years, and that needs to keep increasing in the years ahead. So there has been many valid investments by this government, and there's more to do. Admittedly, there's more investment that needs to be done in the years ahead. So, when we do fund that particular organization, Aid Saskatoon, to a level today, and we'll continue to in the future, and we'll continue to look at applications that multiple organizations have in the budget processes ahead.
Go to Murray.
What about the risk to the province right now with the added traffic? Right now, we're in the second biggest bump in terms of COVID cases in a 10-day span. Certainly having more international traffic and travel would put us at greater risk. What do you say to the people that are actually kind of worried right now that we've worked so hard to keep our caseload down in Saskatchewan? We're going to bring in this for questionable in their minds results and perhaps put at risk the progress that they've made in terms of the actual flattening of the curve?
Yeah, that's a valid question. Those are valid concerns as well, as international travel has been a source of the spread of COVID-19. I'll let Dr. Shahab speak in a moment to some of the conversations that he has had with the Saskatchewan Rough Riders and the CFL organization. I know those conversations have taken place in other jurisdictions as well. I would say this, that there's been a great effort made, and I failed in thanking Dr. Shahab and his office for the work that he has done with the CFL and the Saskatchewan Rough Riders on what safe parameters that would be put in place for just this type of an event, and to ensure that the individuals that are coming are quarantined, are in a bubble, are not putting most certainly the general population at risk, but also not putting one another at risk as coaches, as players, as team support staff. So wherever this hub city occurs, if the federal government comes in behind and supports this league, I think it's fair to say that the risk needs to be minimized as much as it most certainly can be, and I think that work has been ongoing, likely a little bit of work left to do, but I think people can be quite confident that that work is taking place on what safe play looks like. Do you want to speak to any of the specifics on that, Doctor?
Yeah, thanks. So, similar to any international travel currently, it would be expected that anyone coming internationally would have to comply with, the general federal quarantine rules. But we already know that there are some exemptions that are given, for example, for air crew, for long-haul truck drivers, for other, oil and gas sectors, because they may have to go back and forth quite frequently, and can't, air crews, for example, can't be in 2 weeks quarantine. So we've already learned that in those settings, as long as there's other controls that are put in place that may include, self-monitoring or monitoring by trained staff, more frequent testing as and when required, and not exposing yourself to large gatherings, that has been safely managed. But certainly in these situations, the best option is you complete your 2 weeks of quarantine before engaging in any play. But if there's any federal exemptions that are approved, then obviously you remain within a bubble that's pretty tight in terms of your team and the team you're playing with, and minimizing any contact with the host community. And those those principles seem to be effective in settings where they've tried. But obviously, the plan at a high level is appropriate, but it needs to be done in a consistent way. But certainly with other sectors that have exemptions, we have seen that people who work in those sectors have taken that responsibility very seriously, and there has been minimum transmission. The other thing I think that I just want to add is that, related to travel, that we about a month ago we were really cautious about. We were not recommending interprovincial travel. Now it's permissible. The message still is, enjoy summers closer to home, but we continue to see occasional transmission that, in our case, is mostly due to travel to, Alberta, BC, and I'm sure they say the same occasionally from travelers from Saskatchewan. And that is a reality that obviously, if you need to go, you need to go, whether it's essential, family, or other reasons. And we just need to self-monitor, be prepared to isolate if we're unwell. That's what all of us need to do, whether we are on personal or business travel. And if, for professional sports associations, there's actually going to be a specific setting where the expectation is that they would be within a bubble. So I think in some ways it'll be easier for individuals in that setting than it is for citizens who are, for example, are doing long-distance trucking, for example. They still have to come to their home in Canada, but isolate or self-monitor as much as they can.
There's strengths and weaknesses, to the bid. If you look at the facilities in Saskatchewan with Mosaic, most certainly, but also the International Trade Center in Queensbury, all in that area. The facilities here are second to none. But the international travel is a concern, and you can see how that would be a little bit more of a concern in the case of Saskatchewan's bid, where we don't have quite the international flight capacity and access that maybe a Winnipeg or a Calgary has. So these are things that the CFL will weigh alongside public health officials, and I think people that are concerned, they most certainly, I hope, would understand that public health is engaged every step of the way to ensure that any risk is mitigated as much as it can possibly be.
Is the fact that we have such a low caseload in Regina, which is probably lower than any other city, maybe except for Winnipeg right now, a factor in terms of the presentation? And I guess more to Dr. Shahab, what's worked in Regina compared to your other districts, where we're now the second lowest and perhaps soon to be the lowest, given the rate of infections in the central area? Have you done any analysis as to what's gone right here as opposed to elsewhere?
Yeah, so first of all, in general terms, and I'll just say this at a very high level, that, if you do expect to see transmission waxing and waning in large communities, small communities, and that in itself should not be the decision point to be a host community. I think the fact that we have low transmission is a good thing, but if we were to see a bit, some higher transmission, you are actually cocooning or separating that whole activity from the surrounding community. So that in itself should not be a factor. But having said that, I think it's always nice that when you have low rates in a major urban center like Regina, that's always good. I think Saskatoon similarly has had overall low rates, but obviously, they've seen more of an impact due to international travel, which is still happening. It's less common, but it's still happening. We can expect to see international travel actually increasing over the next few months. And again, the Federal Quarantine Act has worked really well when people self-isolate, sometimes to a significant effect when they can't meet the allowed months till they complete the 2 weeks of quarantine. But that has worked really well. But having said that, sometimes there is transmission to close household contacts after international travel. Similarly, travel from other provinces has been a factor, more so in Saskatoon. It's a bigger urban center than Regina. But we also have to remember that, PA had, Prince Albert had no cases of 5 or 6 weeks, then it had 6 hospitalizations. They always see a lot of activity in the summer. There were some cautions that were sent out around, stay home if you're unwell, seek testing. They haven't really seen that increase, and so that's really positive. So the message seems to go out that they had an increase in testing, case contact investigations, but they haven't seen an increase in community transmission. So that's all is positive. And what it really means is that what all of us do actually changes the direction of COVID activity very quickly. And similarly, the south and central parts of Saskatchewan were extremely quiet, had hardly any cases for 3.5 months. Now they've seen a bit of a spike, primarily in communal living settings, but also in the surrounding communities. But again, actions that we all take can, in many cases, mitigate that transmission, which is what we are seeing now in the southwest and the central part. So I think this will keep happening. We will see clusters happening. We'll have to understand the transmission settings and just adjust our day-to-day activity. And my final comment on this would be, we haven't seen that to the same extent, but I know nationally and in North America, there's been a lot of concern with younger people, in terms of not being that maybe thoughtful about physical distancing, keeping your bubble or virtual bubble to the same 15 people. And that's another area where, not so much in Saskatchewan, but there has been an increase in transmission. And again, I think it's summer, people want to be outside, restaurants and bars are open, but we just need to be mindful of keeping each other safe and following those guidelines.
Go to our next question. Adam, do you have a question?
How many deaths in the last 4 months can be attributed to COVID contributing to being a factor outside of the ones that are listed as 15? So are there any deaths where people have passed away, there have been tests afterwards where they may have a contributing factor of COVID listed? Do you have those numbers?
Yeah, so other provinces have done a review of their vital stats where they have looked at average deaths by month this year and previous 3 years. We have put in that request to vital stats in Saskatchewan to see retrospectively if we saw an increase in overall death rate. And there's 2 reasons why we want to look at that. One is, of course, did we miss any COVID deaths? And generally, in other provinces similar size to us, that's been very small. The other, of course, concern when health systems were paused was that people, even if they were having chest pain, were not seeking urgent health care. So those are 2 reasons why that's valuable to look at. We have that request in. We don't expect to see large numbers, but certainly that's something we would like to track over time, and in the fall as well, because as you know, in the fall, we always get some increase in mortality due to influenza, so that's something we'll be tracking.
A follow-up question, Adam?
Yeah, the privacy commissioner has said that it wouldn't infringe on rights if we were naming communities where COVID was and the number of cases, unless it was a very, very small community. And I have to say that this is probably the most common question I get from the public is COVID in my community? And I know you've answered in the past that we have to act as if it's everywhere, and I think everyone's been doing that. So can people expect, as we see cases rising, more, I guess, more information about where cases are and how many cases are there, why or why not?
So, I would like to say that I think there's 2 sides of this. One is that, for example, let's say that I live in a town of 500 and I have a family of, an extended family of, 3 households, 15 people, and we come back from a holiday we took in another province or internationally. We come back, we quarantine for 14 days, and 3 of us developed COVID, and then 4 other people in our immediate household developed COVID. So that's 7 cases in a community, but they're all contained. They all remained quarantined for 2 weeks as cases and contacts. So then you have maybe 7 cases in a town of 500. What does it mean to that town? Nothing at all. On the other hand, you may have a town of 10,000 where you have 3 or 4 cases where they just didn't go anywhere, didn't do anything, don't remember being in contact with someone who's unwell, but test positive over a 2-week or 4-week period. For me, those 4 cases in a town of 10,000 are more significant because you can't explain where the exposure was than those 7 cases in a town of 500. So I think that we really need to understand the context, and that's why when in the PAN area, that's a community of 60,000, which expands by several thousands over summer. When we saw 6 hospitalizations after many weeks of no cases, we did flag that as an area of concern and encourage people to seek testing if they're symptomatic, and stay home if they're feeling unwell. But that's what we'll have to do. That it's not just the numbers, it is the context. And similarly in the Southwest and Central West, although there's been large numbers, most of them are actually due to active case finding. And we need to understand that, just like for the Northwest, the cases really rose because there was active case finding on public health, cases and contacts offered testing. That really increased the case numbers, but they were accounted for by active case finding. So it wasn't just the numbers, it was that, okay, are we understanding the transmission? Are we putting in steps to minimize transmission? And similarly in the Southwest, most of the cases are due to active case finding. So although they appear to be large, they aren't, and of course they are a concern for the impacted communities, but we at least understand the transmission and we can work with the communities to control that. But then the sporadic cases still are a source of concern. And so I think that's how we'll have to keep addressing it, not just focusing on the numbers, but the settings. And with the sectors that have reopened, I think on the one hand, it's very reassuring that we haven't seen transmission happening in gyms, for example, in retail environments. And that's because all of us are actually following the guidelines. And also, it is concerning when you hear reports about, people weren't following the guidelines and that's this setting or that. I think that's something we just need to be mindful of. Business owners are doing their part. We need to comply with the guidelines. If a business requires you to wear a mask, please wear a mask. Don't get into an argument. If, the businesses are doing their part to have signs so that you can maintain 2-meter distancing. But, this is not the time to stand close to a friend you haven't met for a while and have a chat, because it complicates things for the business as well. And so I think that's just something we need to be mindful of as we go forward.
Take our next question in the room. Britton?
So obviously the Rider Hub City came out, and can you just go into specifics from a public health standpoint what a hub city is going to look like? Because the NBA, they're all in Disney World, kind of away from everywhere. We don't have something like that here in Regina. So where exactly would you put this bubble in Regina?
So the initial discussions we've had, again, like the Premier said, we have a lot of capacity in Regina is a city of 200,000 plus, but the capacity in terms of the stadium, convention centers, hotels is significant. So there is that capacity to house teams, and it's not just the players who come. There's a whole team that comes. There is the capacity to house them safely, and obviously those hotels or sites would then be only for players and their teams and not for the general public. And similarly, there is a capacity to have training and other settings that are only open for players and other staff. So there is sufficient capacity, and I think that's the reason why Regina felt confident placing a bid. But then, that'll have to be managed, obviously, in a way that, and obviously, the players and the teams would be very motivated themselves to maintain isolated because they don't want any, not just transmission happening, but any perception of that either. So, the way it's planned out should work quite seamlessly, and there's high level of motivation in making it work in that way.
Yeah.
What about other testing protocols? Because you're going to bring in a lot of players from the States and other countries. Is there going to be testing every day for them, or kind of how's testing protocol work in this bid?
Yeah, that's a really good point. And testing overall, as you know, it's been evolving. Even in Saskatchewan now, testing is open to anyone who needs to seek testing. But we already know that testing is more likely to be positive if you're symptomatic. And if you're not symptomatic, a negative test today means nothing for tomorrow. So the best principles are what we already say to even sports teams in Saskatchewan that are playing, that don't go to play if you're unwell. When you're playing even contact sports, minimize your close social interactions before and after the game. Maintain that physical distancing on the bench, and while you're socializing, play in tight bubbles. So we don't want even for minor leagues in Saskatchewan, people traveling within the province or interprovincially right now. Play locally with 3 or 4 teams. Right now the cap is 50. I think that's serving us well. It is hard sometimes because you want to play with more teams, but that's the principle that's serving us well even for minor leagues. So I think that would be the same principle, and if required, there can be increased access to testing. But we need to understand that testing doesn't always give you the answer for tomorrow. Even if you're negative today, you still need to do everything else every day to keep everyone safe.
And we'll take our next question on the phone lines.
We have Mark Smith with CTV.
Hello. With testing now open to everyone, we've been hearing about some long waits, sometimes days, for people to get tested after calling 811. Is the province considering opening more testing sites to help deal with this backlog? What is the plan to make sure people are getting tested faster?
Speak to that, and then I'll go after.
So I'll get some updated numbers on testing numbers and wait times for Thursday. But there's a couple of things in that. One is that if you have been a close contact of a case, the general public health advice still is, stay at home for 2 weeks. You don't need to be tested. If you're asymptomatic after 2 weeks, you're free to, you no longer have to be in isolation. If you develop some symptoms, it is a good idea to, an 811 helpline can give that advice, that it is a good idea to continue to isolate and wait for 2 days, because if you get symptoms, it may be COVID, it may be something else, but your test is more likely to be a true positive if you wait for a couple of days till symptoms develop. So that shouldn't be taken as a having to wait for getting a test. It's you are identified as a contact. If your symptoms are developing, wait a couple of days so that it's a true positive, not a false negative. But having said that, obviously, we do want people who think they need to get tested to be able to get tested in a timely way, closer to their home. So we can certainly get some updated numbers related to that.
I would just add to that, Mark, the testing capacity that we have of 1,800 to 2,000 tests a day through the Roy Romano lab, as well as we have some capacity with some of our mobile testing units, our Gen Expert testing units that would add to that. We've had to use that, not all of that capacity, but we've had to use that as recently as over the course of the last week, where we were up over 1,300 tests a day for a number of days, and that was due in part to, yes, all of the tests that we're doing through our testing centers, but also in the same way we did in the northern community, in many of our southern communities, we were going door to door, doing some testing, most notably in some of our Hatarian communities. This also builds on the agreement that the provinces signed through the Council of Federation table with the federal government last week on the Safe Restart, where a significant portion, billions of dollars portion of that agreement will be transferred to the provinces, so that we can apply those dollars to increase our not only our testing capacity but our contact tracing capacity, as well as some dollars to advance our data. Our data collection that we have as well, which is already important, but I think will become even more important as we get into some serological testing and some of the antibody testing that will ultimately be coming. So there's likely more testing capacity that will be available as we start to expand the types of tests that we are doing in the weeks and months ahead. But right now we're thankful that we have the capacity that we have. We haven't needed to use it all as of yet, but that isn't saying as these outbreaks occur, and they have been occurring, we've been able to manage them with identifying, contact tracing, and isolating those that are positive. As they occur, we may need all of that capacity at some point in time, and we're actively looking at what we can do to actually increase our capacity, not necessarily increase the number of tests that are done, but increase our capacity of testing so that these individuals, and this would be able to potentially access a test a little quicker. It has been flagged, and we don't want people necessarily waiting unnecessarily for a test, but as Dr. Shahab says, there are times when you might want to wait a day or two for a test so that you don't receive a false negative.
Do you have a follow-up question, Mark?
Yes. According to the Provincial Education Act, all schools must observe the laws and regulations in the province in relation to a communicable disease. Will the school procedures be similar to those in businesses? And what standards will be followed in schools to ensure kids are kept safe?
To ensure kids are?
To ensure that kids are kept safe during the school year.
Yeah, I would maybe at a high level go through what's occurred there thus far. Is our public health department has put out some of the high-level guidelines. The school divisions then came back with some of the plans that they have for each of their facilities, and there is a team that is put together with a number of stakeholders, including those of the Saskatchewan School Boards Association, the Saskatchewan Teachers Federation, that all have input on the approval of what those plans look like as they go back now to the school boards for their implementation. And that's the stage that it's in right now, is where that committee is looking at the plans that have been put forward by the school divisions. Do you have anything to add, Doctor?
Yeah, I'll just say that, every year when school starts, there's obviously close collaboration with public health and local schools and school boards around the usual outbreaks that happen every fall. There's influenza, there's other coughs and colds, there's norovirus. So public health has a long relationship of working with schools. Now with COVID-19, on a positive note, we have seen that, for example, daycares have remained open without any significant concerns. And so that gives a lot of confidence for the elementary schools that if COVID transmission remains low, schools will start with some specific guidance around avoiding large assemblies and treating the class as a cohort, and some measures that reduce transmission risk within the class setting, but at the same time give young children as normal a school experience as possible, because there's been concerns as well with the fact that schools have been closed for the last 3 months, and that does impact on the not just education, but social skills, mental and physical development that's so important in these years, and schools play such a great part in that. So, but certainly if there was a case or a cluster in a school, public health would work closely with schools in terms of what further steps need to be taken. And similarly, if there's higher transmission in a community where there's a school, again, if there's any changes to school operations, that advice would be given.
I would just say that this system of clarifying the information is, in my mind, working quite well thus far. The expectation would be that the committee will be getting back to the school divisions in very soon, so that our teachers, our educators, our administration staff, our bus drivers all have the opportunity to have some time to prepare for a little bit different return to school, yes, but also so our parents have the opportunity to understand exactly what what the guidelines are and what will be occurring in our classrooms. So it's our hope that I believe it's the education response team, if I'm not mistaken, which has representation from the school boards as well as the Saskatchewan Teachers Federation on it. We'll be communicating back to the individual school boards very soon with what the parameters are for a safe return to school.
We'll take our next question on the phone lines.
We have Murray McCormick with Leader Post.
Hi, guys. The CFL has just announced that Winnipeg has been awarded the hub city on a tentative basis, being pending pending final approval of public and health safety officials in Manitoba. Premier Moore, I wonder what you think about that development. I know you probably don't know if you're on Twitter yet, but it's been announced. What do you think of Winnipeg beating out Regina for the hub city?
Well, I'm disappointed. We wanted to host this here in Regina, not only because we love our football team and we love the CFL, but we most certainly felt that there was an economic impact that the city of Regina would use. So we're disappointed that it's been awarded to Winnipeg. In saying that, listen, there's a number of hurdles that still need to be crossed in order for this amended schedule to occur. We'd be supportive of the decision that the CFL has made. We most certainly, want a strong CFL for our Rough Riders to play in, not only this year, but for the next 110 years. So we're disappointed that it's not in Regina. But in saying that, if we have to go to Winnipeg to get our Grey Cup, we'll go do that.
Do you have a follow-up question?
I was talking about a hub city, make you feel optimistic there'll be a 2020 season?
Well, they're one of the larger hurdles that it does need to be crossed is the federal government needs to make a decision on the request that's in front of them. They have a request from the CFL, which is a gate-driven league. It does not have the revenue sources that the NHL would have in the way of other agreements with broadcasting companies and sponsorship. So they are a gate-driven league, and so if the CFL is to have an amended season this year, they would need the support to the federal government. I know those conversations are occurring, and I would hope and would be supportive of the federal government moving and making a positive decision there. Because, like I said, unfortunately, if we're going to bring the Grey Cup home to Regina, we're going to have to, it looks like we'll have to travel to Winnipeg to get it, to put our name back on it.
We'll take our next question on the line.
We have Saqib Shahab with CBC.
Yes, hello, hi. I just have a question. I would like to go back to the testing. I just would like some more explanation around the 48 hours to wait, because we know that, for example, in Manitoba, the advice is just to wait like 24 hours and then get tested. So I'm just wondering, like, why this is different here.
Yeah. So I think general principles are that anyone who thinks that they should get a COVID test is, welcome to call 811. But I think it is important to clarify, and thank you for the question, is that sometimes we get a question or 811 gets a question that, I was a close contact to someone, I've been asked to stay home for 14 days. I'm fine, it's day 5. If I get a test now and it's negative, am I free and don't have to stay in quarantine 14 days? And the answer to that, unfortunately, is no. That if you're fine at day 5 and your test is negative, it means nothing for the next 9 days. You still have to stay. So I think that's a common misconception that some people may have. If you're a close contact, you really do have to isolate for 14 days, because a negative test today means nothing for tomorrow. And similarly, someone may have traveled from another province and they are fine, but if they develop symptoms, they must isolate at home till they test negative. So in many cases, especially if you need to get to work, the test will be done and prioritized, for example, in healthcare or other essential services. If the test is negative, you're still symptomatic, you still have to stay home and in isolation till your symptoms are gone. But if your symptoms progress, you may need a repeat test or a third test. So in some cases, people do need 2 or 3 tests if the symptoms continue, to either rule in COVID-19 or rule it out. But even if 3 tests are negative and you're still symptomatic with the fever and cough, you still have to stay home till 48 hours after your symptoms have resolved. And if it's COVID positive, you have to remain in isolation for 14 days from the day your symptoms started. So I think sometimes it is a complicated message, but certainly if you have to isolate for 14 days because you're a contact, certainly getting a test on day 5, for example, doesn't mean that you don't have to complete the 14-day period.
Do you have a follow-up question, Sophie?
I get that point, but it's just like, it's kind of weird to have that difference between recommendation between provinces. So I just like to understand well, like, why we have to wait 48 hours here, and in Manitoba just after 24 hours it's like you are ready to be tested. So yeah. Difference in the testing procedures here, or I don't know.
So we can certainly look at the guidelines in neighboring provinces, but generally, I think what we have currently has worked well for us. But again, I think one thing we need to understand is that, these are just layers that we have to use. Physical distancing, mask use if you can't maintain that 2-meter distance are the first 2 layers, and I think, we can't stress that enough. And that's because a third of cases can be transmitting while asymptomatic. So you haven't even reached the testing stage. Seeking testing is essential if you're symptomatic, because that informs all of us about community transmission risk. So even though we get concerned when we see numbers, I want to welcome increased testing, and if that increases numbers, we should not be afraid of that. as we are out and about more, we need to encourage more testing. If you get high numbers, that's fine. At least you know what you're dealing with. And so it's not transmission that's happening and no one knows about it till you see sudden increase in hospitalizations. So I think we have to understand that we need to encourage testing even with mild symptoms because more people are out and about. And then, of course, contact tracing is the other thing, that the earlier you get tested and if you're positive, having a low number of contacts is good so that even if you're out and about, you should be able to count your close contacts, on the fingers of your hand, ideally less than 10, because we have seen now that as people are out and about, they have more contacts than when they weren't, and that's fine. But as long as you're maintaining that physical distance, you're keeping your virtual bubble tight, your close friends who you may be closer than 2 meters, limited to as low as possible. The limit is 15, but as low as possible. At least that helps with contact tracing if you do test positive. But I think those are the principles that will see us through this.
We'll take our next question on the line.
We have Erin McNutt with CKOM.
Hi there. I was just curious, with yard and garage sales being able to resume, how is that going to work with things like having a social bubble and a contact tracing sort of list if you're going to essentially strangers' homes?
Yeah, thanks. I think that's really important point. And what we have seen, for example, from the retail sector is that businesses have really laid out their business plans really well. And all of us have learned how to shop safely. And we would really like those same principles when we go to a garage sale. I know a few that I've been to, there's a lineup right at 9 o'clock and people rush to get the best things. But we just need to give each other that space. And even if there's a bit of a crowd, we have to give each other that space. And I guess, people who are setting up a garage sale as individual homeowners, obviously you don't want people to get together to have a large garage sale, but if you're setting something up outdoors in the garage or driveway is better than is the recommended setting, and laying things out in a way that there's enough room for people to come and look at things, and while maintaining that 2-meter distance from other households. You can be closer together if you're from the same household. But I think the responsibility really is on all of us to, behave responsibly in garage sales to minimize risk to others. So you should not come back from a garage sale and say, I was a close contact to anyone. All of us should be able to maintain that 2-meter separation. And certainly if people want to use a mask, even though it's outdoors, certainly that would be a good thing to do as well. And of course, sanitize your hands before going to the garage sale, sanitize your hands afterwards, set things aside for about a day, or launder them or clean them if they can be. I think those are basic principles we need to follow to minimize any risk of transmission. And of course, don't have a garage sale if you're unwell. Don't go to a garage sale if you're unwell. The principles that apply to shopping apply to garage sales.
Do you have a follow-up question, Erin?
Yeah. So with these sales, would the people having them have to follow similar rules to businesses? So, putting out these used items, would they have to have them segregated from the rest of their home for 24 hours?
I think generally, it's, usually people do set up a garage sale a day before, but the onus is on the business, on the person having it. Obviously, it's not a formal business; it's a homeowner who's choosing to, have a garage sale. But the onus is also on the person purchasing that. Both have shared responsibility to just be, conscious of the fact that they need to minimize risk to themselves from purchasing something that may be gently used, as things are in garage sales.
We'll take our last question from the phone lines.
We have Zach Becerra with the Star Phoenix.
Good afternoon. Dr. Shahab, earlier you mentioned the growing proportion of cases that have no known exposures, such as some of those that we see in the Southwest. I'm wondering if that, combined with perhaps the slight uptick in the number of young people testing positive, if that concerns you at all, beyond the context of just those localized outbreaks, if that speaks to any greater, more concerning trend.
Yeah, absolutely. I think what we do know is that we know that our social mixing has gone up. It went to as low as, so if we take business as normal as 100% social mixing, our social mixing and the modeling group really likes to use that in their models. when they predict, surges. Our social mixing went as low as 40 to 50% because, only essential people in essential industries were working, and even there they were not socializing. They were maintaining the physical distancing. Now that we're out and about, our social mixing is going up maybe 60, 70%. It may increase in the fall again with schools opening and to some extent post-secondary education, other sectors opening, and that's fine. But within that, we have to maintain our physical distancing. So when we see a case who can't list any exposure to a known case, and you can't find a chain of transmission, there's obviously always a cause of concern. What happens through case content investigation is we do try to see, okay, which settings were you at where transmission could have happened. And so far, most of us go shopping. We haven't really seen consistent signals that shopping seems to be a consistent risk, which is very good. We've seen a few signals that even though bars and restaurants have opened, we've seen a couple of transmissions in those settings, 3 actually in a bar/restaurant setting where there were 2 transmissions in one setting, just 1 in another. We haven't seen ongoing transmission. So what that shows is that the guidelines seem to be working so far. But obviously, we remain very interested when there's a sporadic case about can we identify some commonalities among the sporadic cases. One signal does seem to be interprovincial travel, and that would, when you go to another setting, you may not really be that knowledgeable about how to maintain that physical distancing. So that's just a reminder for all of us that if you're traveling interprovincially, even on holiday or business, just be mindful of maintaining that physical distancing while traveling. But again, those are, continue to happen sporadically, haven't really climbed up to a significant level. But, again, there's a question about naming communities with cases. This actually highlights why we can't just, if we have a community with no transmission, the fact we see sporadic transmission anywhere means that there's always going to be low level of transmission because 20% of transmission is asymptomatic. And we need to maintain our best practices anywhere we are in the province, seek testing. And if we see a sporadic case, we do try to see if we can identify a chain of transmission. If we can't, we always need to flag that. And if we see an increase in sporadic transmissions, we'll have to see if are there any sectors that are high risk. And certainly not so much in Saskatchewan so far, but we've seen places where people are close together for prolonged periods of time, indoors, is where transmission happens. So funerals, it's a time of great grief. You want to reach out and comfort someone who's lost a loved one, transmission happens. It's hard to stay away and attend virtually. Even if you choose to go as a closer family member, it's hard to maintain that physical distance, but that is where transmission happens. Similarly, even small gatherings, we talked about garage sales, but even just like restaurants have business plans, even if you're planning a small gathering, outdoors is better, plating the food out is better, behaving a bit differently from last year if you're having a backyard barbecue is important. And I think because that's where transmission happens, those everyday, day-to-day things. And, there may be, if you just have one case and that person went to a barbecue here, another event there, it may have been at that small gathering, but we can't pinpoint it. So it's if there wasn't a second case in a barbecue, we label that as a sporadic transmission. But we do know from both experience in Saskatchewan and other sectors that those day-to-day interactions where we're closer than 2 meters, where we are, it's fine if you're in a social bubble, but if you're in a restaurant or bar and outside of the social bubble, I think that's where we just need to continue to take care.
Do you have a follow-up question, Zach?
I do. It's on another public health issue. I hope you'll forgive the question. Some of your counterparts, Dr. Shahab, in British Columbia as well as the City of Toronto, have called for the decriminalization of simple possession of drugs. The Canadian Association of Chiefs of Police have also asked the federal government to decriminalize simple possession, and that call was backed up by some police departments here in Saskatchewan. I'm wondering where you stand on that, if you believe that simple possession should purely be a health matter, or if you have any recommendation in that regard.
Yeah, thank you for the question. So, we have to recognize that in Saskatchewan over the last, almost 2.5, 3 years now, we have made great progress on addressing, mental health and substance use disorder addictions as primarily an issue that is a clinical issue, a medical issue. And there's been lots of initiatives as part of the interministerial task force, lots of initiatives at a community level where there's been strong collaboration between police services, mental health and addictions, and other community organizations, where it is primarily a mental health and a substance use disorder issue. And again, that's true for any substance, whether it's substances that we are very familiar with many of us use. For example, alcohol. 80% of the population consumes alcohol, 60% responsibly, 20% may have challenges with that. Cannabis has been another substance that has been legalized, and we have seen some issues with cannabis, but again, we need to recognize that while some individuals may consume cannabis in a responsible way, for some it does lead to a substance use disorder which needs to be addressed and managed. And of course, while there's been a longer history in Saskatchewan with pharmaceutical opioids being diverted or being used in a way that creates a dependency, and of course crystal meth as a substance that's caused significant harms. We've seen the toll that illicit synthetic opioids have taken, especially fentanyl and analogs, in terms of a much higher rate of overdose deaths throughout Canada as well as Saskatchewan. Our overdose deaths due to illicit synthetic opioids has been rising over the last 2 to 3 years. But on the other hand, the fact that there's the Good Samaritan law where you can call 911 without any fear of legal follow-up if it's an overdose. The fact that we've seen a record uptake, not just of take-home naloxone kits, but use of take-home naloxone kits, where there have been more than 150 instances where they've been used and have reversed overdoses. So I think generally we are moving in the right direction, but we have to recognize that even during the COVID-19 lockdown, mental health and possibly substance use disorders became more challenging when there was some obviously challenges due to employment, isolation, and resumption of access to mental health and addiction services. So this is an ongoing challenge that we have to face as a society and as communities. And so from that perspective, obviously there's a supply issue that law enforcement deals with, but for individuals who have a substance use disorder, I think the focus should be on partnerships that create the pathway to harm reduction or recovery, whatever the option is for that individual at that point in time. And from my perspective, public health, mental health and addictions, police services work quite closely on this issue at a local level, but also at a provincial level.
One of the examples of that collaboration is our PAC teams, our police and crisis response teams that work very closely with families and individuals that are undergoing mental health and all too often subsequent addiction challenges, and helping direct them to the rehabilitation services that are available, and working through whatever the crisis may be. As an example, I think that was just announced again, some of the support for our PAC teams across the province last week.
Finally, Stephanie Taylor.
Thanks. Mr. Premier, is your government at all open to, besides the federal government's ask from the CFL, is your government at all willing to give either the riders or the CFL any kind of provincial money?
So the ask is before the federal government. The federal government has a decision to make. We have not been asked for a financial contribution aside from what was put forward in this particular application for the hub model here in Regina, and we move forward with this. Yes, because we do believe in the success of the football team and the league, but we also felt that there was a substantial opportunity here to have an economic impact on Regina and the surrounding area, which is why we supported this particular model. If there was to be an ask, I won't go too far into hypotheticals, but we'd have to look at what the parameters of that ask are and what the benefits of that ask might be. So without knowing exactly what all entails on there, I most certainly wouldn't provide an answer on that right now. Yeah.
With the CFL's news that any 2020 season would be held in Winnipeg, that means Mosaic Stadium, obviously the team wouldn't be collecting gate fees, anything like that, which is kind of the driver of how they make their money.
Right.
Are you open to providing any additional support to the riders or even the city of Regina that depends on that kind of revenue to pay off the stadium, now that this decision has been made? And I know it's different than the hub model, but.
So with respect to the riders, that conversation is happening at the federal level right now, and we'd be supportive of the federal government moving to support not only the Rough Riders, but supporting the CFL and the strength of that over a century-old league. With respect to the municipal support, we provide in this province already unprecedented operating or unspecified municipal support in the way of our municipal revenue sharing. That's become very evident during our conversations with the federal government on a safe restart in the municipal portion of that plan, of which we're working through the details of how those dollars will be apportioned not only to Saskatchewan, but then ultimately how they'll be apportioned to municipalities here in the province. So the municipalities have received, like other years, their portion of the municipal revenue sharing. We went far above that this year with an additional $150 million in the municipal economic enhancement program, which has only been utilized or put in place one other year in the history of the province. We provided those dollars so that municipalities would be able to continue with any of the capital projects that they had, so that we can continue to actually rebuild the economy by continuing to build our community. So our level, in addition to that, there will be dollars that will be flowing through this Safe Restart program that we have signed, the $19 billion program that we have signed with the federal government. We're working on what the parameters of how those dollars will flow and how we'll be able to get them to the municipalities as soon as possible. In addition to that, there is another opportunity for it would be some of our larger municipalities that have actual public transit systems to partner with the provincial government on some degree of federal provincial support for our transit systems. And again, we're working through the details of that. That also is a part of the Safe Restart Agreement, working through what those details are with the federal government, and then also working with it would be the larger municipalities that actually have a public transit system.
So what happens to that $3 million commitment now? That you made? Is there any thought that might now go towards helping the riders? Or
Well, there's a number of other COVID support programs that we're looking at. We're not finished. We have a number of other sectors of our economy that continue to be challenged. We have the hotel and entertainment sector, the tourism sector. There are a number of continued supports that we continue to look at and to work on with the leaders in that industry. We'll obviously have to just sit back and have a look at this this particular decision, of which I just learned about. We felt every decision this particular decision was made in the isolation that we felt that there would be the economic activity would far outweigh the investment that was made. So we made the decision. We weren't successful in the bid. As I said earlier, there's a number of challenges that we have here in Regina. Most notable, I think, among them would be the access to international flights, direct international flights.
I'm sure a little confused. When was the actual bid made by the province?
I believe it was submitted, but not by the province, but by the Saskatchewan Rough Riders last week.
And with the $3 million commitment is part of it? Or?
That was part of it, as well as some other financial commitments from other organizations as well.
I'm sorry to keep you long, but just to clarify, so now whatever is going to happen to that money, something will happen to it, but it won't necessarily be going to specific COVID other programs. It'll go for more economic programs.
I can't speak to where exactly those dollars will go. It's part of a much larger budget, a $15 billion budget that we have here in the province, and we've worked very hard to support not only our COVID healthcare response, of which we just came through a fairly significant discussion with the federal government on this Safe Restart Agreement, of which provides us additional resources in the way of personal protection equipment, testing, contact tracing capacity, municipal supports that will flow through, as well as some childcare and some supports for vulnerable people as well. And so, there's a lot of dollars that are flowing around for different supports. One, to support the healthcare delivery, but two, then also to support the recovery of the economy here in Saskatchewan. All of our economies, our Canadian economy, has been challenged the last number of years. We feel very bullish and positive on the ability for the Saskatchewan economy to climb out of this challenge, and to do so quite quickly. We we kept more people working proportionally here in Saskatchewan than many other areas. B, we have what the world needs as the world begins to recover, and we're in a fortunate position with not only our COVID case numbers, but in the makeup of our export-based economy. So we look forward to, the next number of months and hopefully being able to, recover, our economy not only to what it was previous COVID, but even grow it from there.
Okay, thanks everyone. That concludes today's conference.